Hello, my name is Peyton and I am from LaPorte City, Iowa, and currently living in Chicago, Illinois. I received my undergraduate degree from Limestone College, where I received a bachelor's in biology. Currently, I'm working in an outpatient clinic in downtown Chicago and some of the surrounding neighborhoods. On a typical day, I could see patients from their late 20s all the way to Medicare patients in their 70s and 80s. I work with a variety of body parts as well as a variety of functional levels and patient goals.
Hello, my name is Mary Crumley. I am originally from Cedar Rapids, Iowa, and I currently live in St. Louis, Missouri. I went to undergraduate at Luther College in Northeast Iowa, and I majored in chemistry and minored in mathematics. Currently, I work in an outpatient neurological clinic, and I work with individuals with post-stroke, post-traumatic brain injury, spinal cord injury, and post-amputation. I also see clients with vestibular impairments, and I also perform the wheelchair clinic.
Hi, my name is Alyssa Gilland.
And I'm Jordan Gilland, and we're the Gillands.
I grew up in Ottawa, Illinois, and I did my undergrad at St. Ambrose, and then I went to grad school, obviously, at St. Ambrose as well, and I ended up staying in the Quad City area.
I'm from Bluegrass, Iowa, just outside of the Quad Cities. I did my undergrad at University of Iowa, go Hawks, and then I came back to Davenport to attend St. Ambrose for grad school.
So I currently work in an outpatient orthopedic clinic, and in this area, it's not just strictly orthopedics. We get a little general thrown in there as well. You see the average older adult who has balance issues or strength issues as well. It's a really good mix. I'd say that I see maybe 30% surgical and then probably 70% non-surgical cases.
I also work in outpatient for a large, same hospital system Alyssa works for, and see a very similar caseload, and I now supervise a couple of our clinics, so it's been good.
I decided to choose physical therapy as my profession due to my personal experiences with physical therapy. I played basketball at the collegiate level, and with that came 3 knee surgeries due to a recurring knee injury. I spent a lot of time with physical therapists, trainers, and observing in the training rooms, and I quickly realized how I could really see myself doing this, as well as enjoying it. What also led me to the profession is how unique physical therapy is compared to other healthcare professions, where we can really build a one-on-one connection with our patients, which was really important for me as well when deciding my career.
I chose physical therapy school because I had done 2 summers of research in the lab, and I really wanted to do a profession that was going to be focusing on working and helping with people. My mother is also a physical therapist, so I was well aware of the profession and what it entailed.
So I chose PT as a profession, kind of like a very typical high school girl. I was injured, I tore my ACL and had to go through a fair amount of therapy myself. And I knew how much it meant to have my physical therapist in my corner, helping me get back to the, prior level that I was at. And I just hope that I can do that for someone else.
And I chose PT because my dad is a PT, and he's loved his job for as long as I can remember, and was all the inspiration I needed to pursue the same field.
I chose St. Ambrose University because I did the Track 1 program, and that was pretty appealing to me. I finished my undergrad in 3 years and then moved on to grad school for the next 2.5 years. That was great because I was able to, minimize the amount of time in school, save money, and get out there and work earlier.
I chose St. Ambrose University because it was in Iowa still, and it was a small college similar to my undergraduate, and the class size of the physical therapy program was small. I also really enjoyed my interview process and the professors I interacted with.
I chose St. Ambrose University because right off the bat I could tell it was a close-knit community and family. I was quite nervous with a lot of my other physical therapy interviews. However, at St. Ambrose, the staff, the current students, and the professors that interviewed me made me feel very comfortable, and I left with a great impression. I also gravitated towards the small class size. This is something I was used to from my undergrad, and I also knew that I was going to be able to form relationships with my professors and my classmates a lot easier.
I would say my biggest piece of advice would be to save in any way or shape you can. Live with your classmates, get a job, work part-time, do everything you can to minimize the debt coming out on the other side. My second piece of advice would be, don't get too worked up about grades. It didn't become clear to me until after PT school that everybody got the same initials after their name, so stressing out about getting a less than stellar grade in one class was really a waste of time when it was all said and done, that I didn't realize at the time.
One piece of advice that I would give to people considering physical therapy school is spend as much time as you can in the clinic and in as many different settings as possible, and this will allow you to decide what is the best one for you.
Advice I have for those considering physical therapy is if you love interacting with people and forming relationships on a daily basis, this could be the profession for you. There are a variety of demographics and settings that you can work in so you can reach both your career and personal aspirations. Physical therapy allows you to be very creative, as well as there's an exponential growth for what we're going to be able to do, as well as the autonomy we're going to obtain in the future, which makes it very exciting.